This morning, it's time to face up to your desire to rejuvenate your face while giving you the look that you've always wanted. Dr. Jeffrey Raval is a facial plastic surgeon and medical director of Rocky Mountain Laser Aesthetics. They're located in Cherry Creek North. He's a double board certified facial plastic surgeon. Smile, doctor. We're looking at you. The head and neck surgeon who has been named one of the top facial plastic surgeons in America by the Consumer Research Council of America. Now, Dr. Raval's office offers the latest cosmetic surgery procedures with a professional staff of full-service procedures. Today, he's back again, this time to demonstrate with us a great new peel to rejuvenate your skin. It's great for sunspots, age spots, wrinkles, even acne, and it doesn't even require the use of a laser. It's called the Rocky Mountain Melanage Peel, which he developed. Pam's also here to receive the treatment, and Stephanie is the esthetician helping out today. Nice to see all of you.
Nice to see you.
So, doctor, it's great to hear about the different treatments that you offer. Tell me more about the Rocky Mountain Melanage Peel.
So it's a melanage peel that we actually added a moisturizing cream to years ago, and it's actually now, believe it or not, included into all the melanage peels. It's a great peel to get anyone started who comes in with concerns of age spots, sunspots. It even helps with fine wrinkling. So, and the other great thing about it is it really, aside from laser treatments, it really is beneficial for anybody with any skin type.
You know, I've actually used this melanage peel on my skin growing up. Gosh, in Arizona, to get those sunspots, it does make a difference. And it takes immediately, like just a couple days until you actually start seeing the results? You
do. It's really a neat peel, because what it is, we actually start by applying, and we'll show this in a minute, some retin-A, a very high concentration of retin-A and some light acids onto the skin. And that kind of opens up the skin, allows for better penetration of some of the other ingredients that we subsequently add in the next few days. And so you start seeing the results immediately, you start peeling a little bit immediately, but the improvement continues to occur over a month's period of time, or 6 weeks period of time.
Okay, you can call 303-381-FACE. That's 303-381-3223. Is there a certain type of skin that it works best on?
You know, the lighter skin, with someone with lighter skin with a lot of sunspots, age spots, it works very well. But you can also have people with what we call melasma, you know, the pregnancy mass.
I got that.
Yeah.
I had that. It's horrible.
And you can see that in any skin type, and this works well with all of those. And we have some before and afters at the end that we can show you of people who had the melasma that had the peel.
Okay. And Pam, so you've had this done before.
Yes,
and you're happy about the results so far?
Oh, I loved it.
Okay.
It's so exciting to see the difference.
What was your major concerns when you went to Dr. Raval?
My major concern was finding the best doctor. And I checked with my neighbor who was a doctor, and she said Dr. Raval was the best. And so that was the major concern. And then after my consult with him, I felt whatever he suggested would be the best for me.
Okay. And can you show me how this works? Stephanie, you've actually done the melanage peel on me before. You can see the before and after here, 303-381-FACE.
So she has, as you can see in her before, a lot of sun damage over time and wrinkling. And after just one peel, and this is, again, continuing to evolve, you can already see that she's getting some improvement with the pigmentation, the fine wrinkling. And we knew when we first met with her that it was going to require a peel or two, and then maybe some laser treatments, which we did. We did a couple laser treatments also on some of the more persistent sunspots. And it doesn't mean that this is the end-all answer, too. We're going to do some more treatments as well. But we'd like to show how the intermediate step, how you're already beginning to see some improvement.
Definite improvement. And just looking in the mirror, I bet it just makes you feel great when you wake up in the morning and you can see your skin so natural, spot-free from all those sunspots, right?
Correct. You got it.
And again, what we do is it's just a it's interesting because it's a month-long peel in a way you want to think about it. And then we start off by giving her a strong retin-A solution with some light acids. It's a unique formulation that was developed by the company that created the Melanage Peel. We added the moisturizer to it a few years ago and called it the Rocky Mountain Melanage Peel. Now the moisturizer is part of the whole regimen. And that's what we have right here. And I can just show you. Once Stephanie's done doing the peel, then we have them start on a series of treatments that we have here, a series of creams that they do for the next 6 weeks. And the nice thing about this is that it's all included in the one package. So you buy the one package, and it doesn't, not only does it include the retin-A that Stephanie is applying right now, Now, is it the Retin-A right now? You're putting, yeah, so she's going to do the Retin-A now, then she's going to apply some light acids, and then we're basically done for today. Once this is complete, she's going to leave this on for a few hours, and then she's going to start on this regimen for the next 6 weeks.
When I was in the office, and Stephanie, you remember this, I had this put on my face. Then I drove home, watched TV, relaxed for a few hours, washed it off, and then started the regimen the next day with this.
Yeah.
I could see within 2 days the difference that it was making on my skin. You mentioned acid, doctor. Automatically people are going to think, wow, acid on your face, but it doesn't hurt. There may be just a little bit of tingling,
Yeah,
right?
a little bit of tingling. It's not very strong acid. You know, it's just like a glycolic. Well, a lot of people have had glycolic peels, and a glycolic is an acid as well. It's just a very mild acid, and it really is just to help get better penetration of the subsequent products that go into the skin.
How you feeling, Pam?
Great.
Yeah.
It doesn't even, it just feels like a wet cotton ball on your face.
And the nice thing about it is that you really can't tell. She can walk out, and really it's not that noticeable. People don't know you've had anything done.
No.
And it's just something you leave on, and
Makes a big, big difference.
Yeah.
And going back to the product here that we can show on the table, so this is what you do follow-up care for. How long is it, a month?
actually, it's good for about 45 days.
Okay.
So we start off, and this is the key thing, is the peel cream, which has got something called arbutase in it. Arbutase is a skin lightening, brightening cream. It's a depigmentation cream. We used to use hydroquinone. There's some controversy with hydroquinone, so we switched over to something, this is arbutase, which is, there's no controversy. It's fairly safe.
Good.
And then there's some other ingredients like a soothing cream. You can get some irritation, so we have a cream that's got a light steroid on there that helps with the soothing. A sunblock that we use. And then we have some foaming cleanser, something that will help clean. It's very gentle.
I use that daily.
Yes. And then the redness balm, which has got the steroid in it.
All right, so we have some pictures that we're going to show here, some before and after of other patients.
Yes, so this here's a typical example who had the melasma that we were talking about, the pigmentation, the pregnancy mask. You don't have to be pregnant to have this, but you can get the pigmentation, and you can see how she looked after a peel. Another patient with some hyperpigmentation in the lower 2/3 of her face. We did the peel with her, and after her full treatment, you can see a great reduction. Younger kids, even who've had some significant sun exposure, can have some pigmentation. What you can also see here that's really great is some fine wrinkling improvement from the peel as well. It's not geared towards that, but you can see an improvement with that as well. In another case, a little bit darker skin, again, emphasizing that we can do this for pretty much all skin types, and a great improvement after a melanage treatment.
Boy, before and afters are amazing. Now, this is Pam's, again, the before and after, and that's after just one treatment.
One treatment after a few weeks, and again, we're doing another treatment with her today.
Very impressive. You doing good, Pam?
I'm just doing fine.
Great. And
I'm so excited about what the outcome will be.
And it really depends on the doctor you choose. You can go to Dr. Raval. Thank you so very, very much, Doctor.
Hey, no problem.